everybody. Dr. Erin Patterson here with the ADHD Queens Podcast. And today we're talking about the ADHD Blues. Now, I don't know if anybody else calls them that, but what I mean is those sad, depressed, down days where you just want to hide in the bed and not do anything, because that's part of the emotional dysregulation part or piece of ADHD that people don't really talk that much about. There's nothing in the diagnostic criteria for ADHD that includes mood dysregulation. So if we look at the diagnostic criteria for ADHD, even though it's been updated as recently as maybe a decade ago, there's still nothing in here about emotional dysregulation. We've got fidgeting, tapping hands, leaving seats, squirming in seats, running about, feeling restless, not able to engage in activities quietly, feeling like you're on the go, driven by a motor, talking excessively, blurting out answers before the question's been finished, or interrupting people, difficulty waiting their turn, that sort of things. Those are all of the hyperactive symptoms. Then the distracted or inattention symptoms are just failing to give close attention to details, making careless mistakes, difficulty sustaining attention, doesn't seem to listen when spoken to directly, doesn't follow through on instructions or finish tasks, difficulty organizing tasks and starting tasks, avoiding tasks, losing things necessary to complete the job, or easily distracted by external stuff. No mention in here at all of any kind of mood stuff, but mood is almost always part of the picture. So think back, like when you've got lots of stuff to do, your list is super long, you get overwhelmed. It kind of creates this cycle where I'm looking at all of this stuff that I have to do, and then I get overwhelmed by it. I start to feel anxious by it, and then I shut down. I can't do any of it. Oh my gosh, I need to avoid it. So I maybe lay in the bed or doom scroll or just like turn into a potato on the couch or something. And then what happens is we start this whole like, we're beating ourselves up. We're criticizing ourselves that I should be getting up. I should be doing this. What's wrong with me? Why can't I just do the things? And that kind of feeds into this depressive state where it looks a lot like depression. We're not getting anything done. Maybe it's difficult to get up and get a shower. Maybe we're just hiding in a dark room. We're not answering text messages or phone calls. It's this real shutdown that happens. And it looks a lot like depression. And then so, I think I mentioned this in probably the first episode, but then when you go to the doctor and you say, I'm feeling anxious and overwhelmed by things, and I'm having trouble getting things done, and I'm sleeping a lot, or I'm feeling depressed, because it does feel depressed. And then the doctor says, oh, well, it must be depression. Let's put you on an antidepressant. Well, then nothing happens, because it's not that it's a serotonin problem like we've talked about before. It's a dopamine problem. And so I think it's important for us to understand that these like depressive periods go along with having ADHD. And a lot of times it's a secondary manifestation of ADHD rather than the, I guess the way that it looks all the time, right? Depression looks like that all the time. And there's usually not a trigger for depression. A depressive episode is biological, so it's just there. It comes because our serotonin is not right, or whatever all of the other neurotransmitters are. But an ADHD depressive episode is what, and I think we mentioned this in the previous episode, called depressive reactivity. So it's a depressive reaction that happens because of a trigger. And that trigger might be, I'm not getting my stuff done, or, here's a big one for anybody dealing with estrogen and progesterone spikes and, all of those hormone cycles that go through that. That can also create depressive episodes for ADHD folks. And I think it can just in general, because when our estrogen level peaks, that's when our social skills are at their peak. We're feeling confident. We're feeling good. you're ovulating at that point, so it's time to go shop for some sperm. So we want to hang out with people. It's all about the procreation. But when that estrogen bottoms out and we're getting ready to have cycles, the progesterone is up, the estrogen is low. And estrogen also impacts the way that we absorb medicine. And so when your estrogen is low, you're not absorbing medication at the same rate. So progesterone also creates a more anxiety, more tendency to be isolated, more tendency to be moody and not feeling good emotionally. And then so we've got that hormone up here and estrogen down here. The estrogen also is impacting how much we're absorbing our medication. So if you're prescribed 15 milligrams of something, your body is not absorbing all 15 of those milligrams. You may only be getting, I don't know, 75 to 80% of that medication instead of the full benefit of it. So then even the meds that we're taking are not as helpful as usual. Ruby's about to hit the tripod. There are some, my brain is not working today. So also, this is going to be a fun one to edit. So while we're speaking about all of these crazy hormones, let's just bitch about hormones for a second. Because not only does being in the luteal phase of your menstrual cycle make your medications less available in your bloodstream, but it also makes the symptoms of ADHD worse in general. A lot of women in particular notice that their brain fog, their mood, their ability to plan or think. Ruby is biting the cord of the mic. Did that come through at all? Anyway. Okay, she's a little wound up today. That's okay. Ruby, stop. All of the ADHD symptoms tend to be exacerbated when we are in that luteal phase of the menstrual cycle because our estrogen is low, and estrogen is a protective factor. The more estrogen we have in our bodies, the better functioning we are overall. And so you think about the times in a woman's life where her estrogen is bottomed out. So right before her menstrual period in the luteal phase, right after childbirth, and postpartum hormones can last up to 10 years. I hate to tell you, that is a long time for us to be in postpartum. And also in menopause. So we also have a lot of women who are not getting diagnosed with ADHD until they hit menopause. And now we're not having these swings of I'm functional, I'm not functional, but I'm functional again, and then I'm not functional. In menopause, it just all crashes out. And then, I've got so many women coming in and saying, like, I am not the person that I was. I can't function. I'm depressed. I'm like not getting stuff done. I've never been like this in my life. And so, the hormones play a huge impact in all of this. And I was watching a video the other day that was talking about menopause, and apparently shoulder pain is also a symptom of menopause because we have estrogen receptors in our shoulders. So when our estrogen bottoms out, our shoulders are used to having estrogen in them, and then it causes things like frozen shoulder syndrome. I'm like, oh man, this estrogen is really messing us up. We need it, and then it just leaves us once a month. It just abandons us, and then we have babies, and it leaves us again, and we're not functioning, and we're not sleeping, and then menopause comes, and oh goodness. So yeah, hormones are a big impact on that. Come here, come say hey. Oh, she doesn't want to work today. The ADHD blues. The luteal phase makes me blue. This is why I don't sing. There may be an ADHD Blues song out there. Is there? Oh, yeah. Come here and let me listen to it on this thing. If I put it close to the microwave. The microwave! That's not a microwave. Oh, man. Okay, let's see. This is called the ADHD Blues by Jasmine Solana.
Well, I'm always running late. I got no fix on time. Drives are mine. It's always a fight. Father time wins every race.
She got the blues, the ADHD blues. No! There's a gnat in my... There was a gnat. This is not Chardonnay.
It's a black fly in your Chardonnay.
This is an energy drink. Oh, the ADHD blues make me chaotic. Listen, my brain is not functioning today, and I am medicated. And I did consider doubling my dose because I knew that my estrogen was low, and I am on the struggle bus. Ugh. A couple of weeks ago, Ruby was having a real hard time. She was also experiencing all of the hormones associated with estrus. And she refused to work. Oh, God. She's too big. So, we've talked about what the ADHD blues look like and how hormones impact the ADHD blues. Now let's talk about what do we do with them when they show up. So, there are a couple of options. I really want to say so less. Say less. Say so less. I am boiling right now. Just boiling. And it's not even that hot outside. It's been about 1,800 degrees outside every day, but today it's only in the 80s, I think. Yeah, the humidity is also 100,000%. Let's talk about what to do with those ADHD blues when they show up. Number one, I think it is helpful if you can recognize that this may be caused by I have too much to do and I'm overwhelmed by it. It could be caused by I am hormonal and there's not really much I can do about that. It also can be caused by burnout, like you've been doing too much and now you've kind of just burned out. So each of those things, you would need to do something different. When it comes to I have too much to do and I'm overwhelmed, a good thing to do for that is sit down. I know you don't feel like it when you get in these shut down, depressed, hiding from the world modes, but if you can sit down and set just a few teeny tiny goals for yourself, we call them micro goals, so that maybe you can get a little bit off of the list of things to do. Then a lot of times what happens is the activity then causes us to feel motivated to do more activity, and that alleviates the depressed feeling, because some of the depression can be coming from the fact that we're beating ourselves up about not getting the things done. So getting the things done can help the depression go away, because you'll say to yourself, oh, self, I did a thing and now I feel better because that was something that was sitting there for me to do. Now I'm, not a broken human being who can't do anything, and look at me go. So that activity will oftentimes start to alleviate the depression naturally. When it comes to hormones, we just need to remind ourselves literally every day of the hormonal cycle is a different level of hormones. So tomorrow there will be a different level and maybe we'll feel better. This will not last forever. But on those days, talk to your doctor about, do I need some mood support specifically during this week or however many days it shows up for you? Or do I need to, increase some medication during that point? Those kinds of things. And don't avoid, if you are medicated for ADHD, don't avoid taking those medications while you're in that depressed place, because the medications a lot of times can help kind of pull you out of it. Because remember, if it's the reaction of the situation, the depression is a reaction to the situation, then the ADHD symptoms themselves are what cause that. So not being able to start tasks or finish tasks, not being able to prioritize or figure out what needs to be done, or time management, all of that stuff, struggling with all of that can create the depression in the first place. And so you need to take your medicine so that that's not exacerbated. Once your medicine kicks in, maybe you'll feel like, okay, let me just get up and go wash 3 dishes, or let me get up and, go dust, or let me get up and do something that only takes 5 minutes, or let me answer one text message. So those things can help the depression alleviate. There is a type of therapy intervention out there called behavioral activation, and research shows that it actually works better to treat depression than a lot of the medications. And the idea is that every day you are going to do something social, something outdoors, and something fun, I think. Let me fact check those. There's 5 categories in behavioral activation. They are routine things, pleasurable things, necessary things, social things, and mastery. Now, you may not be able to do all 5 things all day, every single day. But if you can, okay, let me socialize with one person, or let me do one thing that is routine, like brush my teeth, or let me do one thing that is necessary, like wash these dishes. A lot of times that's enough to interrupt the ADHD blues enough to get you going, and to kind of get you out of the funk. Yeah, so if you've been doing too much, it can also show up as a result of burnout. And so it's important to remember that occasionally when that happens, that's your body telling you, you just need a break. You need to rest. You need to disconnect, and recharge. And I think it's important to remember that rest is also productive. It's just productive in a way that we're not accustomed to thinking about. Your body can't heal if you don't rest. Your nervous system cannot reset if you don't rest. And so it is productive to rest also. Lastly, I was going to say that when it used to happen to me before I learned that it was because of ADHD, I would set a time limit. Okay, this is here, and instead of letting go on for a week like I used to do in college, I'm going to let it just be here for a shortened time frame. So I started out with giving it 24 hours. I'll let it be here for 24 hours, and then I'm getting up and I'm doing something, and I'm getting out of the house and I'm interrupting it. Now I try to like condense it to no more than 6 hours. You can feel this for no more than 6 hours, and then you have to get up and go do something. So that can be helpful too. Now it's time for Q&A. We've got a question that was submitted several weeks ago from one of our viewers. This question comes from AceBT2YW. Why is it that caffeine can help people with ADHD focus? Do any of the ADHD medications just have caffeine in them? That's a great question. And a lot of people self-medicate with caffeine because it is an over-the-counter stimulant. The ADHD medications are stimulants, but like we talked about in episode 4, most of them are some sort of amphetamine derivative. So it's amphetamine and methylphenidate that are typically in the medications prescribed for ADHD. Caffeine is a separate sort of stimulant. So when you think of different types of, let's say, fruit, there's apples and oranges and bananas, and they're all fruit, but they all are different types of fruit. And so that's how it is with stimulants. There are lots of different types of stimulants. So the ADHD medications are pretty much confined to just methylphenidate and um, the amphetamine, which is the stimulant versions of the medication. There's not any caffeine in those, but caffeine is helpful because it is a different kind of stimulant. And so it's very interesting when you look at the amounts of caffeine. A brewed cup of coffee that's 6 ounces has about 120 milligrams of caffeine. The energy drinks that we're drinking nowadays have about 200 milligrams of caffeine. And a soda, Coke, Diet Coke, any of those has about 60 milligrams of caffeine. And so, they're called, I mean, if you look up nootropics is the name, they are, what's the word? Um, Substances that help support the brain in a positive way. Caffeine is one of those nootropics. So, uh, a lot of people feel a benefit when they have their cup of coffee or they drink their energy drink. It clears up the mind, helps them focus, gives them a little bit of energy. And so stimulants are effective for lots of people for different reasons, but there's not particularly a medication that is just caffeine. I mean, you can buy like caffeine pills at a gas station, but those are like the oh gosh, I have to sleep I have to drive all night and I don't want to fall asleep kind of thing. I think more people are using energy drinks for that purpose now, but way back when those no dose pills at the gas station, had like gobs of caffeine in them. So I think it's an FDA regulation thing. They don't care to regulate the caffeine, so they don't necessarily make medicine with it in it. So hopefully that answers the question and gives you a little bit more explanation. I don't know if caffeine helps with the ADHD blues, so to speak, but I don't think it can hurt. I mean, as long as caffeine does fine for you regularly. If it gives you the jitters, just avoid it. So, what are the things that I do? I let myself lay in the bed for a couple of hours and then I try to get up and move somewhere. I don't recommend watching dark things or listening to dark things. Try to watch happy things. And then, like I said, if you can make yourself do some movements or something, wash some dishes, put a load of laundry in, anything like that. It could be really helpful if you can get out of the house because a change of scenery, way back when doctors actually used to prescribe a change of scenery. Those old movies where you see people sitting in the field in the rocking chair and you know, that they went out because they had a mental breakdown and now they're sitting in a field. But really, it was a change of scenery that doctors would say. You need a change of scenery. You got to get out of here. And so that can be helpful too, to get out of the house. You're not going to feel like doing anything because we don't feel like doing anything when we're in those states. But it is also, we can do things even when we don't feel like doing them. You do things every day that you don't feel like doing. So just kind of harness that and say, I'm going to do this even though I don't feel like doing it. And hopefully it will make me feel better. Another fun thing to do is, how is my mood before I go do the thing versus how is my mood after I do the thing? If you rate those, then you can tell, wow, that actually was helpful or it wasn't helpful. And most of the time it's going to be helpful. So let's see. My mood today before doing the podcast was, if 0 is the happiest and 10 is the most depressed, I was probably a 6. Now that I've been talking and hanging out with y'all, I'm probably worse. I'm just kidding. I do feel better. I'm still gonna go home and lay in the bed though. No, but seriously, I do feel better getting out of the house and doing something. So those are my tips for how to fight off the ADHD blues. And I just remind myself, it'll probably be better tomorrow. I got a yoga class booked tomorrow. Got some nice relaxation planned, maybe. Yoga probably is not going to be relaxing because I'm not good at yoga. Anyway, there you go. So, see, the producer says you know, did my bed rot last night, binge watched My Little Pony, ate my sugar-free applesauce, but this morning I got up and went to the gym at 5 o'clock, and that helped. So moving also, can make a difference. But again, you're not going to feel like doing any of this stuff. And so it really is a mind over feeling sort of thing. I don't feel like doing this task because it doesn't feel like it's going to be rewarding, or it feels like it's too big. That's where breaking it down into the smaller pieces comes in. I'm just going to do a little bit of this task, right? I'm just going to go to the gym for 5 minutes. Once you get to the gym, you're probably going to stay for 30 minutes and you'll feel better. Or I'm just going to go do some chores in the house for 5 minutes. Once you get started, you'll feel a little bit better. Yeah, and that's where she said that, also cleaning your space can help your brain feel less cluttered. So you also have to look and think, I need to assess what is contributing to this. Like I said, is it overwhelm? Is it overstimulation that needs to be addressed? I've got too much to do and I don't feel like I'm, getting it done, or I don't have the energy to get it done, or I'm overwhelmed by it. That's where the micro goals will come in. Is it hormonal? Well, I just may have to ride this one out. There's nothing really you can do to change your hormones. You could go to the gym and release some oxytocin? Nope. Getting a massage releases oxytocin. Serotonin. Going to the gym will help with that. And socializing can help with the dopamine levels, but I mean, you're just going to have to wait until tomorrow. You'll have different hormone levels tomorrow. Also, if you notice that with the hormones, it's a cycle, you may want to get on some kind of hormone replacement therapy where, you're taking birth control and keeping your levels at a more consistent state so they're not fluctuating as much, and that can help keep your mood a little more stable too. Yeah, and then you have to consider what foods am I putting in here? Are have you had a lot of sugar? Have you had a lot of carbs? Those kinds of things can also make you feel lethargic, and the lethargic feeling can then turn into I don't feel like doing the things that I need to, and then it starts this cycle. Now I'm overwhelmed by all of that I have to do, and I'm shut down, and I'm not doing it, and then the depression comes as a reaction. So maybe one of the things that you do is also make an effort to eat some raw food that day, like some fresh fruits and vegetables or something like that. Again, you don't want to do it. You want to eat the donut, or you want to, eat the biscuit or whatever the thing is. But that can make a difference too. So it could be biologically influenced also by just inflammation in your body based on your diet. And last but not least, get in the shower. Wash that ADHD blues right off of you. At the very least, you'll be smelling good. You don't have to wash your hair, but at least wash your skin. It's interesting too. This is just a random fact. If you want a random fact, that they say when people are remembering, they look to the right. And when they're lying, they look to the left. So if somebody is telling you something and they are looking to the right, they're remembering, because that's where our memory is stored. But if they're doing this, they're making shit up. So they say. Okay. You think we got about 20 minutes of talking? Can I quit now? Are we done? Oh, yes. And this side of my eyelashes today were pointing down at the ground. And this side of my eyelashes are pointing up like I curled them. Well, I always sleep on this side, so these always stay curled. But I don't know why these are pointed down like they're sad. My eyelashes have the blues. I got the blues, the ADHD blues. Yep, that's all I got. All right, that's all we got today. So much for the ADHD blues. Thanks for watching. Remember, do all the things. There's a thumbs up somewhere and a bell, and you click that, and we're on Facebook, Instagram, TikTok, Spotify, Apple Podcast. I think that's all. And we've got a brand new website up and running, ADHDqueens.co. No, I didn't leave the M off. I did it on purpose. Okay, thanks. The M was not available. Somebody else already bought that one. But if you really need the M, you can go to ADHDqueenspodcast.com. See you next time.